Hello, and thank you for joining. Today we'll be learning about billing claims and finance at the Health Plan of San Mateo. This is the fourth video we've created to welcome new providers to the HPSM family. We'll cover the basics of finance at HPSM, including how to get set up for electronic payment, an overview of claims at HPSM, how providers can receive additional payments, other HPSM finance policies, and more. First, make sure you get set up for electronic payment. Setting up electronic payment is fast, and receiving payments electronically is more secure and accurate than paper checks. To get signed up, visit the address on your screen. You can sign up for EFTs or ERAs by visiting our provider portal. Our provider portal is also how you check claims, authorization status, and member eligibility, so make sure you prioritize registering for the portal when you join HPSM. EFTs are electronic fund transfers and send claims payments directly to your bank account. An ERA is an electronic remittance advice that makes it easier to access and reconcile payment information. Now that you're set up for electronic payment, let's talk about claims. Before filing any claim, make sure to confirm the member's eligibility. There are a few ways to check a member's eligibility depending on the member's line of business. You can use the provider portal at hpsm.org/provider/portal. The second way you can check a member's eligibility is by calling our 24-hour automated telephone eligibility verification line at 1-800-696-4776. For Medi-Cal members, you can call 650-616-2133 or visit the Medi-Cal website at medi-cal.ca.gov. Let's briefly cover ways to file a claim. At HPSM, you can file your claims by mail or electronically. However, how you file will depend on whether you're a dental provider or a medical provider. Medical providers can submit paper claims on a CMS 1500, LTC 251, or UB04 for claims form only. Please mail these forms to HPSM Attention Claims Processing. To be eligible for payment, dental paper claims must be filed on fully and accurately completed ADA or Medi-Cal dental claim forms with the current CDT procedure codes. Please note, if using an ADA dental claim form, please make sure to use the 2019 version. Claims may be suspended or denied when data items on claims forms are incomplete or incorrect. Please mail dental claims forms to HPSM Dental. There are 3 ways medical providers can submit electronic claims. Providers can submit electronic claims using the standard EDI 837 format. To get set up to submit claims this way, please follow the instructions on the screen. Providers can also submit electronic claims using a clearinghouse and payer ID. See instructions for submitting claims through Change Healthcare, Office Ally, or Capario. You can also use our provider portal to submit claims electronically. However, claims must be submitted using CMS 1500 claims forms. Dental providers can submit electronic dental claims through their existing systems/clearinghouse with the information you see on the screen. Please note that Care Advantage claims are automatically split into 2 claims by HPSM to account for Medicare and Medi-Cal. This means that you will typically end up with 2 RAs back on separate dates, but you do not need to rebill HPSM for the Medi-Cal benefit. Most denied claims and service lines can be rebilled as a new claim or updated or corrected as long as the claim is submitted in a timely manner. Rebilling occurs when HPSM denies a claim because of incorrect information supplied on the claim form. In such cases, you can rebill these claims by submitting a new claim form that has the fixed issue that triggered the denial. For example, you can rebill for claims that HPSM denied because of a lack of required information or invalid data. In most cases, if the claim is denied, the issue can be fixed by rebilling, which also decreases wait time for resolution for providers. To make a change to a previously paid service line, for example, charging the units billed, to report an overpayment, or to request reimbursement for a claim or service line that was originally denied as a duplicate, use HPSM's claim correction form. You can find more information about correcting a claim at www.hpsm.org/provider/claims/update-claims. In some cases, providers will need to dispute a claim as opposed to rebilling it or using the claims correction form. HPSM offers a provider dispute resolution process to resolve payment disputes. The following claims issues can be addressed through HPSM's provider dispute resolution process: claims believed to be inappropriately denied, adjusted, or contested, underpayments, or resolution of a billing determination or other contract dispute. Providers should submit their dispute through a submission of a provider dispute resolution form. The form can be found at www.hpsm.org/provider/claims/disputes-and-appeals. Timelines for claim submissions vary. For Medi-Cal members, here's our reimbursement policy. Claims received beyond 180 days from the date of service will be prorated according to the guidelines listed. Your member cannot be balance billed. We'll discuss balance billing later. Claims for Care Advantage and HealthWorks must be submitted within 1 calendar year of service date. There are many other claims resources available on our website and in Section 4 of the Provider Manual, so make sure you check them out. There are a couple of ways HPSM providers can receive additional payments. You can learn about both of them on the HPSM website. The first is through one of HPSM's value-based payment programs. HPSM's value-based payment programs offer performance-based payments to in-network primary care nursing facility and hospital providers. For questions on these programs or how to participate, please contact HPSM's provider services at psinquiries@hpsm.org. The second way you can receive additional payments is through Prop 56. Proposition 56 is the California Healthcare Research and Prevention Tobacco Tax Act of 2016 and sets aside funds for services performed to improve healthcare quality measures in prenatal and postpartum care, early childhood prevention, chronic disease management, behavioral healthcare, and more. Please remember that Prop 56 payments will come through at a different time than normal payments, and their schedule varies by provider type. Learn more about Prop 56 payments and how to receive them at hpsm.org/provider. Providers who offer services or supplies to HPSM, Medi-Cal, and Care Advantage members are prohibited from balance billing the member for any cost sharing not related to the member's share of cost. This includes deductibles, co-insurance, co-payments, and non-covered charges. Balance billing the member violates state and federal law. Please remember to obtain the member co-pays and/or co-insurance indicated on the HPSM member ID card or co-insurance at the time of service for HealthWorks members. If you have any questions about your RA or claims payments, please contact HPSM's claims department. For members that have insurance other than Medi-Cal, the other insurance will be the primary insurance and Medi-Cal will be the secondary insurance. The primary insurance will always be billed first before Medi-Cal. Claims must be submitted with the primary insurer's RA or proof of non-coverage. See the Medi-Cal manual for direct billable services. Members who are in an accident of any kind and need medical care should inform their provider and/or hospital how they were hurt and where. HPSM will provide covered benefits for members who are injured. For additional information about coordination of benefits, please contact our Provider Services Department. For more information on any of the things we've discussed in this video, please visit hpsm.org. You can review our Provider Manual, our Provider Learning Lab, or you can contact our Provider Services team or our Claims Department. Thank you so much for watching this video, and we'll be in touch.